Just wanna love you for my whole life. Do it for you, I'ma make time. I wanna kick it until midnight, just to be with you till the sunrise. I think you're making me crazy. Put my heart up on the main line. I got this trust for you. Got it 'cause I know what you like. I love you.
Good morning, besties. Can y'all, or do you guys know what today is? Sorry, y'all, I'm going to be moving fast this part because I'm a little behind, like a couple minutes behind on my shot, so I'm gonna try to get the shot done real fast. But what day is today? Does anyone know? Today is day 5 after transfer. 5 DPT. Day 5 past transfer. And does anybody know from my previous transfers what is day 5 after transfer? Well, day 5 after transfer is usually the day I cheat test. Well, I want to be very careful when I say this because, you know, the clinic always says the most accurate results is the beta test. But for me, if I cheat test on day 5, whatever it says on day 5 is accurate for me. Now, I don't want anyone else to do it and it's wrong for them, and then they say, well, you said it was guaranteed, or no, it's not guaranteed. But for me, whatever I get on day, if I cheat test on day 5, whatever I get, whether it's a positive or negative, I take that for the final answer, and I'm always correct. I've had a fail that I did live, a cheat test I did live, and it was a fail. And everybody kept saying, no, you could still be pregnant, Erin. You could still be pregnant. It's only day 5. You know, you're not out until the beta. And I said, I know me. I know how I test. I know for me, on day 5, it's accurate. If it's negative, it's negative. If it's positive, it's positive. And lo and behold, when I got my beta, it was in fact a negative. So, but your clinic's always going to tell you the beta test is accurate, is more accurate. But I said to say this, today is the day that I cheat test. But I'm in a dilemma, you guys, and I need your help with this. I'm drawing up air, we're at 1.5 mLs. And here's where I need your help. So today's the day that I usually cheat test, right? But I'm not gonna lie, you guys. For some reason, I don't want to cheat test. And it's so weird that I feel this way, y'all. And I'm gonna tell you why. Because normally, I'm anxious to test. Anyone that's gone through infertility, you know how we are with the testing. I mean, that's all you think about day in and day out is testing. However, usually I'm trying to cheat the cheat test. Like, I'm counting down to the cheat test. Like, 2 days before the cheat test, I'm like, can I just try now? Or the day before the cheat test, I'm like, should I just try now? You know? Usually I'm trying to cheat the cheat test. So it's very weird to me that I'm not wanting to cheat. I almost want to wait for the beta. Now my beta is on Monday, and I still have 6 more days to the beta because this clinic does, let's go ahead and do the progesterone injection. Oh, you guys, I almost forgot to change to my mixing needle. Change to my injection needle. However, y'all, It's like, I said before in my previous video, this is different for me. It's not different, but it is. So normally, this is my 5th transfer. And anybody that knows my story, I've had 2 transfers where I got a positive pregnancy test and 2 transfers that I got a negative pregnancy test. So I have 2 and 2 right now under my belt. The reason why I only have 1 child from it is because my first transfer that I got a positive from, I ended up miscarrying the pregnancy because I had a blood clotting disorder that I did not know that caused the miscarriage. And once they found that out, that's why I take Levodopa and stuff like that. But all in all, I've experienced 2 successful transfers. You know, unfortunately I had a miscarriage. And then I've experienced 2 fails. So I understand that this is really up in the air. It's really a 50-50 chance. I remember when I first got started with IVF, I thought, oh, I'm going to IVF. First time I'm pregnant. I went into transfer day thinking, it's IVF. How closer can you get, right? The only way, I was thinking in my head, the only way you're not going to get pregnant is if something crazy happened out of this world. But I was thinking it was like going in for fibroid surgery. You're going to go into the fibroid surgery and you're guaranteed when you come out of that surgery, you're guaranteed that the fibroids are going to be gone. That's how I thought about this. You go into a transfer and you come out pregnant. That's how I thought my very first, cycle. I thought it was pretty much guaranteed. I have been in groups at that time and stuff to know that people had fails, but I always thought that those were like they all had some like other issues going on that I didn't know about. Does that make sense? So yeah. But that's not the case. That's absolutely wrong. A transfer is a chance of getting pregnant. It's not guaranteed to get pregnant. Nothing could be completely wrong with you, and you have fails. It's not guaranteed. It's a 50-50 chance. So with me being experienced now, and now really going through, this transfer right here is my 5th transfer, but as far as knowing the results, going through having 4 previous transfers and 2 positives, 2 negatives, I know more than anything that it can go either way. This hurts. Man, I hate when I have to do this by myself. Anyways, like I was saying, I know more than anything that it can go either way. There's no secret potion. Like my doctor said, it's all about the embryo. It's all about the embryo. If it wants to implant, it will. If it doesn't, it doesn't. It's all about the embryo, right? Oh, this one hurts really bad, you guys. That one was hard. That one was hard, you guys. That one was hard, extra hard, I don't know why. Anyways, so I'm getting back to what I was saying. I know more than anything that it can go either way, and that's what scares me. And I know from experience that once I get the pregnancy test, and if it does not go my way, I am depressed. My world is upside down. That's all I think about, right? Now, I know regardless, I'm going to have to know the results. I know this, right? However, it's almost like I want to savor the moment for a little bit longer of the possibility, just the possibility that I might be pregnant, than to hear a damper. Does that make sense? And usually the excitement of finding out if I'm pregnant, because, you know, that's the goal, it is more convincing to me, that makes me want to cheat test. But this time it's like, because I know that there's a high possibility of a fail, and I know how hard I take it, I'm not in the mood to be depressed right now, right? I'm on cloud nine. I just went to transfer day. I might be pregnant, right? That's how I feel. Like, I might be pregnant. Like I'm having a good time right now, right? Like, yeah, I'm nervous and, you know, thinking about, am I pregnant? Am I pregnant? However, it's not disappointing, right? And then so, and anybody that knows me and that watched me through any transfers or failed transfer, whenever I have a failed transfer, what makes me feel a little bit better after a failed transfer is knowing my next steps. But we all know with IVF, they won't even begin to talk to you about your next steps until you have a negative beta test. Not a home test, a beta test. I can take a pregnancy test right now, and it's not going to be negative because you're speaking into existence, but if it was negative, I could call that clinic and say, hey, I cheat test at home, it's negative, I believe it, it's negative, what's my next steps, can you book me with the doctor? And they're going to say, absolutely not. You're not out until beta. They won't even begin to talk to you about another transfer or other possible options until the beta, right? Which taking my rub out, y'all. Which makes it even more stressful because you know you have these bad results at home. You know you're not pregnant, and you're at standstill stressing, and you don't even have, you know, relief from like speaking to the doctor about what went on or what they think about your last protocol, or you can't get any information for another week or so, and you got to sit on this bad news and just not only mourn, because I call it mourn because it's a loss, right? Mourn the loss of that failed transfer, but you also got in your head the wonder, like, what's next? Am I able to do it again? You know, are they going to do, like, are they going to do the same protocol? Do they think that I have, you know, a good chance, or should I give up, you know? But no giving up over here. But, you know, so it gives you a lot to think about. So I'm like this. I'm like, should I go ahead and cheat test today? But then at the same time, I'm like, I kind of want to hold on. Even though it's not a fact, I kind of want to hold on to the possibility of being pregnant for a little bit longer. You know what I mean? I kind of want to do things different this time. And the possibility of being pregnant is a whole lot better than having to face not being pregnant and then having to wait a week in torture of what's going to happen. You know what I mean? A week into your beta, you know, and then you're waking up, going to beta, You're waking up and you're going to beta unmotivated. I'm driving to go take my beta, like, I'm not even pregnant. Like, I'm wasting my time. I'm getting up every morning to do my injections, like, why? You know, like, why am I sitting here doing these injections when I know I'm not pregnant? You know, you're less motivated, you know? So I almost feel like after my fifth transfer, I kind of realize, I'm kind of understanding why they tell you to wait for beta. Because it's less stress, right? If I have the possibility that I'm pregnant, I wake up no problem, happy to take my medicine because there's a baby inside me that needs it, right? That's where my mind frame is. There's a baby inside of me. I'm happy to take my medicine. I'm excited to drive to go take beta. And then guess what? When I take my beta, if that day they call me, because they call you the same day, if I'm pregnant, then everything is good, right? If I'm not pregnant, then I don't have to take any medicine again that day. So when they call you with a negative from the beta, they tell you to stop all medication immediately. But it saves you from having to take medicine knowing you're not pregnant, right? But I'm saying all that to say this. I don't think I'm going to cheat test today, you guys. I think for the first time, this will be my first time ever not cheat testing. I think for the first time, I'm not going to cheat test. I'm not. I'm feeling good right now. I'm nervous, yes. But I'm feeling good. I'm okay. I'm content. And I want to stay that way. I'm happy. I'm happy with the thought that I could be pregnant. I think pregnancy looks good on me, y'all. What y'all think? Because I'm pregnant. But yeah, I will tell you guys this. I have crazy heartburn last night and this morning. Crazy heartburn. Now, I know I am taking progesterone and stuff like that. And, you know, pregnancy hormones can give you heartburn. So it could just be my medicine, because my medicine is pregnancy hormones. Or it could be that I'm really pregnant. And the real pregnancy hormones is what's doing it. But yeah. That's why I was happy right now when I took that Pepsi, because I was waiting for my chance to take my Pepsi, because I've been having heartburn on 1,000. But yeah, so y'all, it's safe to say, no, I'm not going to cheat test. This is going to be my first transfer not cheat testing. Pray for me for a positive. What's going to happen is we are going, you know, on Monday, I'm scheduled for my beta test. That's about, so I got a few more days for that. I will go in the morning. My appointment's at 8:45. I will draw my blood and we will wait for the results. And I will record the results when they call me. And it'll be nice because it'll be different, right? It won't be me looking at a test. It'll be the doctor calling me saying, "You're pregnant!" We're not going to say, they're going to call with the opposite news because we're speaking it into existence. But they're going to give us a call and let us know what the results are. But yeah, I'm not going to cheat test. I'm trying to do this transfer different. And I think I've done good so far. But yeah, I love y'all. I appreciate y'all. Please continue to send prayers up for my family. I love y'all. And I will see y'all later. Bye, girls.